All right, welcome back to ABA exam review and the continuation of our RBT practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Jones takes his cauliflower and throws it on the floor. His mom tells him to go to his room immediately with no dessert. Jones is now throwing cauliflower and green beans on the floor. Sending Jones to his room likely functions as blank. So we have a consequence question here. And what is the most important thing we look at when determining what type of consequence is used? Well, we look at how it changes behavior. Consequences don't affect current behavior, they affect future behavior. And so when you're evaluating a consequence, you always have to ask yourself, how did future behavior change? And so in this case, we're looking at the consequence of sending Jones to his room. Now, in what context does Jones get sent to his room? Well, we know Jones takes his cauliflower and throws it on the floor. The consequence is mom tells him go to his room immediately with no dessert. So Jones throws cauliflower on the floor. As a result, his mom sends him to his room. Now, we ask ourselves, how did this change Jones's behavior in the future? Well, Jones is now throwing both cauliflower and green beans on the floor. As a result of this consequence, what has happened? Well, Jones is now continuing to throw food. And so his behavior maintained or increased. It didn't decrease. And so if we have a consequence that is increasing or maintaining behavior, what do we consider that? Well, we consider that A, reinforcement. The only time we would say a consequence was punishment or was extinction was if future behavior decreased. Always keep that in mind. Reinforcement increases future behavior. Punishment and extinction decrease future behavior. And then we have this idea of non-contingent reinforcement. With non-contingent reinforcement, we are providing reinforcement on a schedule prior to a behavior happening. So reinforcement is not contingent on a behavior. You're not using non-contingent reinforcement here. The consequence is contingent on Jones throwing the cauliflower on the floor. As a result, Jones gets sent to his room. As a result of that consequence, Jones is now throwing cauliflower and green beans on the floor. He's continuing to do it. He's now added green beans. Sending Jones to his room likely functions as reinforcement. Always look at how the consequence affects future behavior. You, a behavior technician, are going about your normal routine with your client when suddenly the client's dad asks you to stop session because he is not comfortable with the intervention that you are using. What should you do? All right, so we have kind of an ethical service question here, and you are acting as the behavior technician, and the question wants to know, what should you do in this situation? Well, what do we know about the situation? We know that you are going about your normal routine with your client, and then the dad asked you to stop session because he's not comfortable with the intervention. So a couple things are in play. One, if you're at session, right, you need to deliver your session to get paid. That's obviously important to you. But we also have a situation where a client stakeholder, in this case, the dad, doesn't want you to continue session because they're not comfortable with the intervention. As a technician, knowing you, one, need to complete your session, and two, need to provide services, what are you to do in this situation when asked to stop session by a parent? A, explain that you cannot stop session as you would not be paid for the remaining time. Unfortunately, that is not relevant here. Although it might be true, it doesn't take precedent over the client's parents having concerns about session. Clients and stakeholders are allowed to terminate and quit at any point. They can quit any point in during service, before service, after service. They have that right. And so if you're asked to stop session by a stakeholder, such as a parent, you have to stop that session as the technician. Now, B, ask what the dad would like to change and implement those changes. Is it your role as a technician to change the intervention based on what the dad wants? No, that is not your role. That is the role of your supervising behavior analyst. They will have the discussion with the parent, figure out what they don't like or what they do like about session, and they'll write up and implement the changes. Your role is to not change the intervention. Your role is to simply implement. And so implementing changes is fine, but you can't go about changing things yourself. C, stop session and contact your supervisor immediately. Absolutely. And you'll notice a trend if you've followed along our videos is what we're encouraging here and what the task list encourages and what the ethical code encourages is open, clear communication with your supervisor. If you're in a situation like this, you're asked to stop session, the first thing you have to do is contact your supervisor and see how they would like to proceed. And then D, finish the session and then contact your supervisor immediately. Unfortunately, you can't finish the session. If the stakeholder wants to stop, we must stop, especially as a technician. So, as a technician, your very next job after being told to stop session, especially because they aren't comfortable with what's going on with the intervention, is to contact the supervisor immediately. And you'll find in a lot of cases, as the technician, your best route is going to be communicating with your supervisor. You're attending an FBA with your supervisor. As your supervisor interviews the parents, you're observing the child and making a tally mark each time the client flaps their hands. What are you doing? All right. You, again, are a technician and you are doing what? Well, you are with your supervisor on a functional behavior assessment. During a functional behavior assessment, typically interviews happen, indirect assessments happen. We do direct assessments, so we'll take some data, and then occasionally a functional analysis will happen. Now, in this case, your supervisor is the one interviewing the parents while you're observing the child and making tally marks each time the client flaps their hands. So, what are you doing? Well, at the most basic level, you're taking a count, right? Each time client flaps hands, you make a tally mark. Now, we could call this frequency, but if it's during a functional behavior assessment, what's another term for taking this frequency recording? A, recording rate. Are we taking rate data here? Not necessarily. With rate, you do have frequency, but you also have a time component. And we aren't adding a time component to our tally marks, at least yet. Here, you're simply taking the count. And so what you're doing is B, event recording. Event recording is a fancy way, essentially, to say frequency or count recording. We do event recording during FBAs, and it's exactly what it sounds like. How many times does a certain event occur? In this case, how many times does flapping hands occur? And so you're using event recording with these tally marks. C, interval recording. Interval recording 1 is discontinuous, and this looks continuous. And 2, to use interval recording, we would have to have intervals. And there are no mentions of intervals in this particular question. And so we don't appear to be using any sort of interval recording. And then recording inter-response time. What's the difference between inter-response time and frequency? Well, one, they record different things. Inter-response time records time. Frequency or event recording records an amount. 2, inter-response time is time in between behaviors. And so inter-response time might be time in between flapping hands. And that's not what you're recording. You're simply making a tally mark every time the event happens. So what are you doing? You're doing B, event recording. Todd is starting to form and say complete words. Todd is attempting to say hungry, but is currently only able to make the H sound consistently. If you were to shape this behavior of saying hungry, where would you likely start? So we have a shaping question. And when you get a term on your exam or on a practice exam or practice question, make sure you define it so you know what you're talking about. It's going to help with fluency. When we are shaping, we are reinforcing approximations of behavior, specifically approximations that are closer to our terminal behavior. And our terminal behavior is the final target behavior. Our final target behavior here is saying hungry. And so that's what we want to achieve. We want our client or Todd to say hungry. And so approximations are going to be behaviors that get closer and closer to the word hungry. Now, where are we going to start? Well, we know Todd is only making the H sound. If we want to shape closer approximations, how can we do that? Where are we going to begin? A, reinforce Todd whenever he says the H sound. Todd is already making the H sound. And so reinforcing him every time he says that likely is going to continue Todd only saying that H sound. With shaping, we've got to push the client or learner forward. So occasionally we might reinforce that sound, but whenever he says it, might only maintain that. And that's not what we want. We want approximations that are closer. B, start to reinforce Todd only if he vocalizes HU or something even closer to hungry. Yes, we need Todd to move closer to the full word hungry. So now Todd is only going to get reinforcement if he's moving closer to saying the full word hungry. C, reinforce Todd for any noises that he makes that aren't H. Now, our goal is for Todd to say hungry. That's our goal. And he's already able to make the H sound. So reinforcing any noise is a step backwards. We're not concerned with Todd making a T sound, for instance, or a P sound. We need that word hungry. And then D, reinforce Todd only if he says hungry. D might be too much of a move forward because we aren't there yet. He's only making the H sound constantly. So if he's only making the H sound constantly, how can we start to shape the behavior? Well, B, start to reinforce Todd only if he vocalizes HU or something even closer to hungry. Which of the following answer choices does not represent an antecedent intervention? Okay, two things here. We have a not question, meaning one of these is not an antecedent intervention, while the other three likely are. And then we have to look for antecedent interventions. What are antecedent interventions? They're interventions that happen before behavior. They are preventative. We're usually trying to prevent something from occurring, or sometimes we're trying to evoke a response. So let's look for an answer choice that is not an antecedent intervention. A, non-contingent reinforcement. Non-contingent reinforcement is reliant on a schedule of reinforcement that does not require a behavior to happen. In other words, we might set a schedule of 5 minutes, and every 5 minutes we are delivering reinforcement regardless of behavior. This typically acts on motivating operations, and it is an antecedent intervention. B, high probability request sequence. Well, with a high probability request sequence, we are giving several high probability requests first, followed by our low probability request. So our antecedents are all these high P requests, and we're going to follow it up with a low P request. So a high probability request sequence is an antecedent intervention. C, planned ignoring. When might we use planned ignoring? Well, we might use planned ignoring once the behavior occurs. We have in place a strategy where we ignore the behavior, and that would be a consequence. And then D, functional communication training. Functional communication training is an antecedent intervention, right? We are acting on the response prior to it occurring because we're trying to evoke more functional communication than before. So what answer choice does not represent an antecedent intervention? That's going to be planned ignoring, which is a consequence intervention. Thank you for watching. Be sure to check out btexamreview.com for all of our study materials. That link is in the comments below. Check out or subscribe, I should say, for all of our updates. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.